Jessica, you're back in a hotel room, I can tell, which means
Thank
that you...
God, I have jacked the air conditioning down. I'm going to take a long shower. I'm going to lay all over the bed. It's going to be amazing.
Well, I mean, clearly you've been in one place in Jacksonville for far too long. I'm surprised you haven't gone crazy.
I have been there for 5 months. Who says I haven't gone crazy? It's the May 21st episode of Health in 2.00.
All right, so where are you and where are you going?
I am in the lovely town of Chattanooga, Tennessee.
Oh, you have to go see the Chattanooga Choo Choo. There really is.
I drove past the historic site, and there's like an Iron Man happening here this weekend, so maybe I'll hang out. And then I'm on my way to Chicago.
Okay.
My kind of town.
Heading back to your hometown. Well,
yeah.
all right.
Happy birthday, Mom. This is my mom's 60th birthday is the 21st.
Very exciting. So that's where you're going. Right,
Yeah,
you're driving to Chicago.
Yeah.
Keeping away from those very dangerous airplanes.
No, I just like to drive. I'm like addicted to road trips now. I drove from California to Florida, and now I'm like, I can drive everywhere.
All
I
right,
want to get through these deals. I cannot believe what I missed while I was on the road.
That's just the last couple of days. All right, you ready?
All right, start that timer. Yeah, let's do it.
Okay.
All right, it's going. Lyra, 200 million more. This brings our total to a whopping 675. I'm shocked.
Well, it's quite amazing. So the valuation I read is somewhere in the 4 billion range, which is, by the way, a lot more than American Wells public valuation at the moment. So we'll see how it goes. You know, obviously mental health is this incredible area. They have raised way more than anybody else in the mental health range. They've still got that deal with our friends at Calm for the meditation app. Interesting enough, also today in mental health, Amazon announced the entire mental health panoply of stuff, and more than Lyra or Ginger or anyone else has got as an offering for all of their employees. So I don't know how they're doing that. We're going to dig in. Interesting stuff indeed in mental health, growing leaps and bounds.
All right, DrFirst gets 50 million. What does this one do?
Yeah, they've raised a bunch of money in recent years, like 150 million, 135 million. This company's been around a long time, was doing e-prescribing back in the day. It's doing something inside the internal medical record, the electronic medical record. I'm not quite sure what, but something.
All right, Jasper Health and our friend Alan.
We finally get it in.
Finally, we've gotten this in. 6.75 million that company raises, and he is the CEO now, huh?
Yeah, this is a new play in cancer navigation. A lot of help required in there. There have been people doing it before. There was a company called Navigating Cancer that does it. There are a number of others. My old Finnish friends at Nuna got their kind of cancer navigation aid bought by the folks at Varian. But the most important thing is that Adam Pellegrini, who's running CVS Health Digital Health, has gone, and he's taken Greg Orr, who's running Walgreens Digital Health, with him. So I don't know who the hell is left in pharmacy and digital health, because they were going to work with Jasper.
No idea. What about testing company Q Health? They get another 235 million themselves. These rounds are whopping. Brings their total up to 405.
Yeah, and they've got some really big federal grants, including one for the Defense Department for over $500,000. So this is, at-home testing. And by the way, Amazon's getting to this as well. They do it.
I opened my mouth, but I couldn't get it out.
We were about to talk about our friends from England coming back to America, taking over.
We're going to have to wait.
We'll have to wait.
We're going to have to wait. Okay, so I have to go back to this mental health thing for a second. So do you think, okay, first of all, 675 million for Lyra total. Is that the most that anybody's raised in this in that space, that digital mental
health for sure, yeah, because I mean Ginger's in the sort of 200s and everyone else. There was, you remember, we actually not only did this, we have to do it again, because for Somebody to Vivu's
going digital behavioral health event,
which is actually in a couple of weeks, we have to update the thing we did last year, right? Remember, there have been a couple of roll-ups of clinics and actual facilities, but in terms of the virtual care stuff, mental health care, this is, and so much of Lyra's has been in the last few months. They're all growing like crazy.
Has to be headed towards some sort of IPO exit, don't you think?
I'm surprised they didn't SPAC out this time, but yes, there has to be an IPO in the near future. I guess the question is, right, when you've got the virtual Teladoc and Amwell stock, under pressure. Well, I mean, crazily expensive compared to their revenues, but way down from their highs, right? Sort of half of where their highs were in Amwell's case, nearly a quarter of their high, 75% off their highs. I don't know how attractive those IPOs are going to be. The SPACs are also back down to where, the SPACs that went up with expectations have gone back down. Having said that, clearly it's huge amount of interest. This investment came from, I think it's called Quartu, which is another private equity company. So this is essentially the same as an IPO. It's just, one player coming in. So you think at some point they've got to do that, but there are, a lot of private companies now out there worth mega billions who have yet to go out. And don't forget, Coinbase and Snowflake, and for these big tech companies, they went out at private valuations that were, in the tens, and in Coinbase's case, nearly 100 billion. So really? I'm not sure Lyra's going to go there. But
Does that ever happen in healthcare, though?
Sorry?
Has that ever happened in healthcare? I mean, you mentioned 2 tech companies, but like,
I'm thinking. Other than sort of restarts of companies that were previously public, like Change Healthcare or IMS Health, which went private, then went public again, or HCA, the hospital chain, just gone, has been in and out of being private and public over the years. But in terms of a startup, no, I think still the biggest IPOs are the ones we're seeing right now. But Bright, which announced for its IPO today as well, that's rumored to be going out of the valuation about 10 billion. Now that's a health plan, so
yeah,
a bit different, but just a ton going. We'll probably cover that in the next session. But yeah, it's a big amount of money. The question that I think is interesting about Lyra and then Ginger and all the other players in the modern health, and
modern talk space,
all the talk space, all those guys, right? Is that the problem is supply of therapists, right? Now Amazon's doing it too. I don't know. Lyra has been very aggressive. By the way, their chief medical officer, Connie Chen, used to work at Health 2.0, much smarter than me, or he also worked at Health 2.0. And she always told me the thing that what Lyra is priding herself on is having the best, most accurate, highest quality psychiatrists and therapists. And I don't know how you get that many of them. A lot of people have been complaining, particularly about Talkspace, about the quality of their therapists. So, whether that's true or not, there's clearly a shortage of therapists. Everyone says that. And yet, we're throwing all this money at it, throwing all this demand at it. So someone's got to figure something out.
I've interviewed Allison Frieden from Modern Health, and I've interviewed Russ Glass from Ginger a number of times. And then just recently, yet to be released, coming soon, I talked to Julia Hoffman, who used to be at Livongo running mental health there and is now running it she's the head of mental health strategy for Teladoc. And what the 3 of them all seem to have in common is that they're working on intake and trying to figure out how to get people into not the therapist necessarily, but into like a lower, like a lesser credentialed person who is less expensive, like a behavioral health coach first, and then try to route from there and then bring in the doctor as part of the care team when needed. So I feel like, you're not.
Or send them to the machine, right? Send them to the CBT machine, like have a High Health, which doesn't have the humans. And if you look at what Amazon says, Amazon has a long list of what it's doing, including get access to therapists and this and the other, but also talk to machines. And we're going to see a lot more of that coming. You still need the therapist, and you need the intake, and you need to get it, and there's a lot.
What I got from Julia about Teladoc and how they're doing their intake, apparently they've got that, remember that old AI plus AI engine that was running underneath Livongo's diabetes stuff and their hypertension stuff? Like that's what they've got that they're using with their mental health as well. And that's like their applied health signaling's this. Like it's pretty interesting, like how she was talking about the different types of nudges that were happening to help guide people into the right type of treatment. It was really interesting. Can't wait to show you that.
All right, well, we're excited about that. I'm looking forward to nudging you off, and don't forget, we have to nudge each other to actually update our mental health presentation.
We will do it.
Or else we have to.
Maybe somebody should get off of Clubhouse and start working a little bit more. I'm not going to name names, but to tell Matthew Holt to stop bullshitting on Clubhouse, he's over at Bolty Boy. And if you want to follow the adventures of me driving to Chicago some more, I'm
Don't tweet and drive.
What?
I said, don't tweet and drive at Just a
I
Massive.
know tweeting and driving, but you know what I'm going to listen to? It's the Spotify or iTunes version of this episode of Health in 2.0, because it is also a podcast for convenient commuting listening. And to never miss an episode of the video version, you can always go to thehealthcareblog.com and sign up for our email newsletter. Thank you, everyone, for allowing me to have such a long commercial. People are
Bye,
gone.
Jess.
We'll see you soon.
Have fun in Chattanooga. We'll see you wherever you end up next.
Yep. Bye.